Early warning signs your body shows when you are at risk of arrhythmias. Arrhythmias, or irregular heartbeats, may seem harmless at first, but they can signal serious underlying health issues. Your heart's rhythm is controlled by a finely tuned electrical system, and any disruption can lead to symptoms ranging from mild discomfort to life-threatening conditions. While some arrhythmias are benign, others can increase the risk of stroke, heart failure, or cardiac arrest. One of the most common signs is palpitations, or the sensation of your heart racing, fluttering, or skipping beats. Palpitations are often harmless, especially when triggered by stress, caffeine, or dehydration. However, if they occur frequently or without a clear reason, they may indicate atrial fibrillation, the most common type of arrhythmia. Atrial fibrillation can cause the heart's upper chambers to beat irregularly, impairing blood flow and increasing the risk of blood clots and stroke. Dizziness or lightheadedness is another symptom to watch for. When the heart's rhythm is irregular, it may not pump enough blood to the brain, leading to a feeling of unsteadiness or faintness. In severe cases, this can result in syncope or fainting, which is a red flag requiring immediate medical attention. Shortness of breath during normal activities or at rest is another common early indicator. An irregular heartbeat can reduce oxygen-rich blood flow throughout the body, making even simple tasks like walking or climbing stairs feel exhausting. If shortness of breath is accompanied by chest pain or a feeling of tightness, it could signal a more dangerous arrhythmia or even an impending heart attack. Fatigue, especially when persistent and unexplained, is another subtle sign. When your heart isn't pumping efficiently, your body's cells receive less oxygen and nutrients, leaving you feeling unusually tired. This fatigue may be constant or occur sporadically, particularly after mild physical exertion. Chest discomfort is another symptom that could point to an arrhythmia. While not as intense as the chest pain associated with a heart attack, arrhythmia-related chest discomfort might feel like pressure, heaviness, or a squeezing sensation. Some arrhythmias, like ventricular tachycardia, can cause the heart to beat so fast that it leads to fainting or near-fainting episodes. These episodes are particularly alarming and should never be ignored, as they could signal a serious underlying condition that requires immediate attention. Sweating or clammy skin can also accompany an arrhythmia, particularly when it disrupts the heart's ability to regulate blood flow effectively. Sudden, excessive sweating without physical exertion might indicate your heart is struggling to maintain its normal function. In some cases, the early signs of an arrhythmia may be less obvious, but still significant. For example, sleep disturbances such as waking up with a racing heart or experiencing difficulty breathing during sleep might indicate conditions like sleep apnea, which is strongly linked to atrial fibrillation. High blood pressure, while not a symptom of arrhythmias itself, is a major risk factor. Elevated blood pressure can strain the heart and make it more susceptible to rhythm disturbances. Similarly, conditions like diabetes, obesity, and thyroid disorders can also increase your risk of arrhythmias and may present their own subtle warning signs. If you notice these symptoms, it's essential to seek medical advice. Diagnosing an arrhythmia often involves a combination of methods, including an electrocardiogram. Blood tests can also identify contributing factors, such as electrolyte imbalances or thyroid dysfunction. Preventing arrhythmias starts with managing your overall heart health. Adopt a heart-healthy diet, rich in fruits, vegetables, whole grains, and lean proteins, and limit your intake of salt, sugar, and unhealthy fats. Regular exercise can strengthen your heart, but consult a healthcare provider before starting a new workout routine if you're experiencing symptoms. Avoid common triggers, such as excessive caffeine, alcohol, or smoking, as these can exacerbate irregular heart rhythms. Managing stress is equally crucial, as chronic stress can elevate cortisol levels and increase your risk of arrhythmias. Practices like meditation, yoga, or deep breathing exercises can help maintain a steady heart rhythm. In conclusion, arrhythmias don't always announce themselves dramatically. Often your body sends subtle warnings such as palpitations, dizziness, or fatigue.